Among the cancers most commonly found in women, breast cancer is one of the most significant. Currently, in India, Bangladesh, and globally, the incidence of breast cancer in women is notably high. Over the past few years, hundreds of thousands of women have been diagnosed with this condition. Today, we will discuss the symptoms of breast cancer in detail. Before we dive into the specific symptoms, it's good to remember that all cancers share some common warning signs that can lead us to suspect the disease. I have a previous video on this general topic. You can find the link in the description box below, or click on the icon on your screen to watch that video. Now, let's begin our discussion on the symptoms of breast cancer. We can primarily divide breast cancer symptoms into two categories: local symptoms and symptoms of spread, that is, metastasis. 1. Local symptoms. These are the signs that appear in or around the breast in the early stages of breast cancer. Breast lump or tumor. The first and most primary symptom is the presence of a lump, mass, knot or thickening in the breast tissue. If you suddenly feel something unusual, it is essential to consult a doctor immediately. However, an important note here: over 90% of lumps found in the human body are benign, non-cancerous tumors. They do not turn into cancer. Still, vigilance is crucial. Ulceration, sore or wound. Sometimes breast cancer can present as an ulcer or sore on the skin of the breast. In other cases, a tumor inside the breast can grow and break through the skin surface, causing a wound. Any such symptom requires immediate medical attention without delay. Eczema-like changes. Rarely, breast cancer can present with itching or a rash on the skin of the breast, resembling eczema. This is a less common symptom. Beyond the breast tissue itself, symptoms can also appear on the nipple. Nipple discharge. If you notice a sudden discharge from the nipple, especially if it is bloody, blood-tinged, or a clear red fluid, it is a reason for concern and should be checked promptly, as it can be a symptom of breast cancer. Symptoms of spread, that is, metastasis. Sometimes even a small tumor can spread, that is, metastasize, to distant organs. When this happens, breast cancer may present with symptoms related to those organs, sometimes even before a noticeable breast lump is found. Spread to the liver. If the cancer spreads to the liver, the patient may present with symptoms of jaundice, such as yellow urine, yellowing of the skin and eyes, which is known as jaundice, and digestive weakness. Spread to the lungs. Spread to the lungs can cause a persistent dry cough that does not improve even after 3 weeks of treatment. Sometimes involve coughing up blood or pain in the back. Spread to the bones. This is a very common site of spread. Most often, breast cancer first spreads to the bones of the spine, which is the back, causing persistent back pain. It can spread to any bone, neck, arms, or legs, causing pain in that specific area. Spread to the brain. If cancer spreads to the brain, symptoms can appear suddenly. These may include fainting, memory loss, loss of vision, or vomiting. Therefore, if you notice any of these symptoms in yourself, your family, relatives, or acquaintances, it is vital to seek a doctor's advice immediately. There is no need to panic or be afraid, but it is absolutely necessary to be cautious and proactive. Let me reiterate. More than 90% of lumps are benign non-cancerous tumors. However, we must always be aware and seek professional evaluation to be sure. I hope you found this video helpful. If you did, Please give it a thumbs up, subscribe to Health Inside Anatomy and Science, and do share your thoughts in the comment section below. I will see you very soon in another new video. Stay healthy, stay well. Thank you.